We are welcoming Mayor Lawler and Deputy Mayor Barbara Borsack today, and I really just want you guys to be able to tell people who live here, just inform them of what's going on with the village in response to this crisis.
Okay, so thank you very much for having us, first of all, and we'll start by just giving you some of the numbers.
Okay, great, thank you.
So, as of yesterday, Suffolk County is up a little bit over 1,000 cases that have tested positive. On the East End in East Hampton town, there are a total of 10, which includes us here in the village, and there are a total of 2 positives here in the village, and 1 that is self-quarantined that has not returned a positive test yet. Mm-hmm. So 2 positives and 1 self-quarantined. As far as what I can report for the public, first let me tell you that there is a mobile test site at Stony Brook University in the South Lot P. And you can call the following number, 888-364-3065. They will triage you on the phone, and if you meet their criteria, they'll make an appointment for you to come in and be tested.
Great.
So here in the village, our village staff, except for police, fire, and EMS, is been decreased to at least 50%, in some cases slightly less, in order to limit the amount of contact among our staff. And we've closed Village Hall to the public, but you can contact us via phone or email, or if something precludes you from doing that and you have to come to Village Hall for business, you could knock on the door. Somebody will come to the door and make arrangements to accept an application or something like that. But we would prefer that you do all of that by email or phone if possible.
Okay, great.
Regarding our public meetings, we're working on teleconferencing our meetings where possible. There may be some legal implications to certain meetings where we may not be able to do that, but we're in the process of trying to do that where we can. Again, teleconferencing, maybe we would have a situation where people could call in with questions during one of our meetings or something like that. What we've done also to help things move along is that we've extended the expiration date for some of our permits, such as our building permits. So if somebody's building permit is about to expire, within the next 60 days, we've extended that expiration 60 days without a fee. So they won't incur another fee in order to extend their building permit. We have closed down the playground area of Herrick Park. We left Herrick Park open. We've closed down the playground area of Herrick Park, and it is ropes off and signed off so that people know that they shouldn't be on that equipment, because experience is telling us that the virus can survive up to 72 hours or longer on plastics and metals. So that's why we've closed down that equipment. Just as far as emergency dispatch, I can tell you that what we're doing as far as our dispatchers are concerned is when they report for duty, they don a mask, and their temperatures are checked before they come into the actual dispatch area and start their tour. So if you call them on 911 or 631-324-0777, and somebody picks up and you are requesting emergency services at your location, they will ask you if you have a cough, if you have a fever, or if anyone at your location has been quarantined.
Okay.
And then they will, of course, get your location and what your emergency is. So when police or fire or ambulance respond, they will respond appropriately with the appropriate protective gowns and or masks. Most likely, depending on the circumstance, only one of the responders will enter the home. They will some of the same questions that you've already been asked before, just to confirm that there is no threat of the virus at the location. And if there is, then they will take proper procedural cautions in that particular case.
Okay, great. I wanted to ask you, if I could interrupt for a second, I wanted to ask about
Sure.
masks, because we've been hearing a lot about how there aren't enough masks for people. How is the village set up for that?
Barbara, maybe
I
you
can
can speak to
answer
that?
that. The ambulance right now has plenty of the small masks. The N95 masks are what is the issue. Those are the ones that are in short supply. We have enough right now, but one of the reasons we are trying to encourage people not to call unless they have a true emergency is that we have to treat every call as a possible COVID-19 call.
Okay.
So for every call, we are using these masks and full gear, gowns, face masks, N95 masks, double gloves. So we're using our equipment on every ambulance call. And that equipment will run out if we are overwhelmed.
Right.
So we're asking people, first of all, if they feel they need an ambulance, if they're having chest pains or if they think they're having a stroke or a family member thinks they're having a stroke, please, yes, call immediately. But if they do not fit into that category for a true emergency, call their healthcare provider first, their local doctor, and ask their doctor for advice. And if the doctor recommends that they go to the emergency room, then we'll, of course, transport them to the emergency room. As Rick said, only one person will go into the house. We will ask them to come out of the house to meet us, if at all possible. We will maintain a distance from the patients as necessary. We have to sanitize the ambulance after every call completely, so it's a long process for us. If you have a family member that can drive you to the hospital, that would be better. Okay. So just be aware of that. We are, of course, there for emergencies, but we don't want to overwhelm the system. We don't want to overwhelm the ambulance system or the emergency room at the hospital.
So if you think,
does that make sense?
Say that I think that I have COVID-19 and
I don't know
coughing.
if I lost everybody.
Oh, you did? You can't hear anybody? Okay, but let me reiterate what Barbara was saying was that, and I think the Ambulance Association has said this as well, to make sure that you're not going to call if you have just a cough, but this is for true emergencies at this point. Mr. Lawler, while we're getting Barbara back, what about the what kind of rules do we have in the village for population density, for people walking around, for all the people who've come out?
Sure. Well, the idea is that people should get out and get exercise. It's good to be out in the sunlight. That's deters the virus. And so, sure, we would like people to be out, but they should maintain a social distance of at least 6 feet. Okay. And obviously, if they're comfortable wearing a mask and they have a mask, that's fine. We're told that that's not necessary if you're going to maintain social distance. As I said, we closed down the playground areas, knowing that children would unlikely think about those types of things. So the park is still open if people want to, do something in the park and maintain that social distance. We also have walkers that come through the park from the long-term lot to get to other services in the village. So that's another reason that we have not closed down the park entirely.
Okay. Is there any other information that you really want to get out to the village constituents here?
Well, just that, of course, the situation is serious, but we don't want anybody to panic. We think that we have things under control. And yes, we expect that the numbers may rise out here, although we've been able to keep them relatively low so far. And, we anticipate that we are doing what is necessary in order to maintain that. So we're hoping that the condition will, continue.
Okay, great. Barbara, are you there?
Yep. Okay.
Can you hear? Do you have anything you want to add?
I think mostly that we want to make sure, people have asked us about beaches. They would like us to close it. It's very difficult, open, public spaces, but we really encourage them to keep their distance.
Could you repeat that, because you cut out a little bit?
We've had some people ask if we couldn't close the beaches because of the crowds on the beaches. And that's a difficult thing to, if we're closing beaches, we're closing public spaces.
Right.
We just really want people to maintain distances and be smart.
Okay, great. All right. Is there
Just
anything
one,
else?
and one, yeah, just one last thing. We've had a lot of people calling in about construction sites that are still workers are still there and working, and we've been working very hard to get a determination from the governor's office as to whether or not they are essential service.
Oh, okay.
So we haven't closed any of them down yet, but they are. We're beginning to hear from the governor's office that they are included in essential services. So we're not going to shut down construction sites, but we are advising them to take, sensible precautions like everyone else, and maintaining a distance, and only having the amount of workers that they absolutely need to do the job for that day.
And
Excellent.
one more thing, I think people should be aware that things are changing every day. There are conference calls with the state and the Department of Health, and so things rapidly. Every day, town website and the village website have updates, have a Facebook page, so they could check for the latest information on any of those sites.
Okay, great. So I just want to reiterate, because you were cutting out a little bit, that people should visit easthamptonvillage.org and ehamptonny.gov. And I have both of those websites on at the end so people can see it, and your Facebook pages, which are great.
Great. Yes.
Okay. All right.
Yeah.
Thank you so
Okay.
much for, being here and helping us get the word out.
And thank you for
welcome.
having us.
So, hi, we are here with Bess Rattray. Bess, could you say your introduce yourself, please? Your title and everything?
Hi,
Hi.
I'm Bess Rattray. I am a volunteer EMT with the East Hampton Village Ambulance Association. And I'm an EMT-B, which means basic. I've only been an EMT for about 2 years. I am not an advanced EMT, and I am not a paramedic. And I'm not an officer with the ambulance either.
And can you explain how the Ambulance Association works? You guys are all volunteers. Is that correct?
Yeah, well, how it works is the Ambulance Association is all volunteers, but we do have a paramedic on duty basically 24/7. Sometimes there's gaps in that coverage, as they try and make sure that they have someone on duty at all times. But there's a paramedic paid per diem, who's available in most of the local East End agencies at this point. Not all of them, though. So at any given time, if there's one ambulance call, there's often a paramedic to go with the volunteers as well. If there's two calls, or the paramedic is off, or the paramedic is already on a call or doing something else, obviously we go without them. And there are some very advanced EMTs with a lot of training in our ambulance corps as well, who do a lot of the things that the paramedics do.
Okay. And what?
So there's about.
No, go ahead.
Oh, I was just going to say the East Hampton Corps is about 44 people, 44 volunteers in regular times, though obviously not. It's an aging population. Volunteering, we've all heard, is sort of dying out in the U.S., so fire service and ambulance tend to be sort of older population.
Okay.
So that's true of the ambulance corps as well. So our numbers now are somewhat reduced because there are people who can't go out on calls because they have an underlying health condition, because they're over 60 or even over 70. So we are not at our full strength right now.
What do you want people to know about about the Ambulance Association and about COVID-19 right now?
Well, I think the most important message that I hope is going out is that if people are feeling unwell, the first thing they need to do is call their doctor. Everyone's heard that hospitals are overcrowded and becoming, overstressed at the moment. And it's important for people, if they're not feeling well or if they're showing symptoms, not to immediately assume they have to be hospitalized or that they have to call 911. The thing that they should do is call their personal doctor, describe their symptoms, obviously the doctor, if they're having severe symptoms, they're having difficulty breathing, that sort of thing, is going to ask them if they can get to a hospital, either with the help of a family member who has a car or calling 911. But that's the first most important thing right now. Our numbers of EMTs are down, the hospital's under stress. And if somebody just thinks, I'm starting to feel poorly, or, I think I need a test, unfortunately, that is not a go to the hospital situation right now. It's a stay home and speak to your doctor situation.
Right.
And that's the important message that our officers want us to get out there.
Because I was thinking about it, and I was thinking on a regular day, somebody can be having a heart attack in a regular day without a pandemic, and they need to be seen immediately, as opposed to somebody who might be feeling a little poorly, as you said.
Well, this is very true. Regular calls go on. People are still falling and breaking hips, and people are still having heart attacks, and all those calls go on apace. The way that volunteer service works in East Hampton, and I think in quite a lot of the other local agencies, there is that we work in squads, and so you have certain requirements, certain duties that you do. In our ambulance corps, you're on a squad every 8th night from 8 p.m. to 6 a.m. Unless you've been in the department, I think 20 years, in which case you can opt for day service.
Okay.
So we're all obliged to do that on those overnights, unless we're unable to run calls at this time because of what I said before, age or underlying health condition. So we're all doing that. A lot of us are trying to go out during the day as well, because we know that numbers are few, and the numbers who can go on a suspected flu-like case or a suspected coronavirus call, it's not a large number of people.
Okay.
So we're told when the call is paged out, if it's something called an FC call, which means fever, cough. Sometimes it'll say Q for quarantine, and that is an indicator that we need to follow certain protocols.
Okay.
In terms of what gear we put on, in terms of how we approach, the patient.
And you said you were going to get back to me about the mask information and all of that stuff that you can talk. We can talk about. You can give me that information maybe later and see what people can do, what they can.
Yeah.
We know that people can donate if they happen to have stuff right now, right? And where would they do that?
Yeah. There's a couple different ways people can donate. For example, if you work in a trade and you happen to have an N95 mask, those are the ones that are really of value to doctors, nurses, and as well as the ambulance volunteers and paramedics. It doesn't matter if it's one that was sold for an industrial purpose like dust, or people who work on a painting and that kind of thing. They did something, I think it was on the federal level, waiving liability towards the makers of those, 3M and so on, saying you will not be held liable if something happens to this mask. So it can be used for medical purposes, is what I'm saying. So if somebody has those in their closets, they could literally take that box and stroll it down to their doctor's office or the ambulance HQ and leave it outside. Obviously, you don't want to be going inside or bothering people, but you could leave it outside with your name attached, put a little note on it, so that they'll know who to thank, and should it not be needed, it could be returned. I know the East Hampton Star is also doing that, collecting anything anyone has at 153 Main Street in East Hampton, and can get it to those most in need. So there's definitely a need for those still. The part I'm not clear on is that recently there's been news that some of this PPE, the personal protective equipment we keep hearing about, some of that has been freed up. A small amount from the U.S. strategic stockpile, that's that federal stockpile we've been hearing about. Small amounts have been freed up from that, but then also New York State has purchased quite a large amounts in this complicated bidding process, and some of that is coming to Suffolk. And there's also private organizations that have donated and fundraised, and I don't know where they found them, but have found not just masks, but the gowns that we need to wear if we're dealing with one of these FC calls, fever, cough. you need booties, you need goggles, you need a gown or covering of some sort of coverall. So people are donating those. I don't know at the moment which local agencies have been on the receiving end of that yet, or if my own agency has been on the receiving end of that yet. And hopefully I can report back about that.
Okay, fantastic. Is there anything else you would like to add about this experience, as about your experience, about...
Yeah, well, I think being an EMT, I think anybody who's a volunteer right now for fire or ambulance or any of that is really aware of and more hypersensitive to this idea of everybody pitching in and self-isolating. Like, for example, recently, just this morning, I was out walking my dog and I noticed a construction site still going full bore. And I don't know if that's still allowed at a non-essential site or not, but, you get this feeling of those people are at risk. They're putting themselves at risk. And by extension, they're putting everyone in the emergency services at risk. So I think volunteering gives you a lot of impetus to really get behind self-isolating.
Right.
So the message is, I saw, the doctors who were at the real forefront of this. I saw somebody on Facebook the other day holding a sign that said, you stay home so that, it was basically, you stay home because to be here for us because we're here for you. In other words, the doctors are taking the brunt of it and putting their lives at risk, really. And all you have to do is just go home. So you feel that very, very clearly as an ambulance volunteer. It's hard. We all have families. We have grandparents or kids at home, and we're all going to do as much as we can for as long as we can, but we're not sure what's going to happen when the numbers dwindle further. We're not sure if we have the equipment or the manpower for what's coming. So that's the message, everybody. Stay home, call your doctor. Don't assume you've got to call 911. And the other thing is maybe, I don't have it right here. I have it on my computer. There's a phone number for the New York State hotline that you call in order to speak to somebody about whether you can get an appointment for testing at the Stony Brook site.
I think, is that the
that's
888-36... I think I have it at the end. Yeah, I know which one you're talking about. I can't remember right off the top of my head the exact number, but that's the number. It's Suffolk County hotline, I think, for finding out
there's a
where to go
Suffolk
get tested, et cetera.
And they'll speak to you, and there's a long waiting time, apparently like 2 hours to talk to someone, but they speak to you, and if they you agree that there's merit to your reason for getting tested at this point, they will give you an appointment to go to that drive-through at Stony Brook. So,
all right. Great. Thank you so much, Bess, for taking your time today. And we'll talk soon.
Well, thank you, Morgan.
Okay.
It's delightful to talk to you. Thank you. Keep up the good work. We love what you're doing.
So here we are today, March 26th, Thursday, with East Hampton Town Supervisor Peter Van Scoyoc. Thank you very much, Peter, for taking the time to be with us today.
Thanks for having me on again, Morgan.
What is it that you want to let people know in the town of East Hampton?
Well, there's a great deal I'd like to let them know, but first of all, I wanted to say that we're handling this pretty well. I'm so pleased to see so many people really taking the strong advice to stay home, to only go out if absolutely necessary. This is critical in slowing the spread of this disease. I've driven here to work. I'm working in the office somewhat, as are some other staff members, but generally only a few people in an office. We're keeping our distance. We're following safety protocols and hygiene and whatnot. A lot of town staff are now working remotely. And, we're encouraged that others are doing that in the community. Again, please stay home. That's the biggest thing. That's the most effective tool we have in East Hampton to deal with this situation right now.
Okay, great. I was wondering about what happened the other night. You said you guys did a great press release yesterday about the White House task force the other night, talking about people who were coming out here or coming out anywhere, leaving New York City, and they should self-quarantine for about 14 days. What is the town doing about that? You're just suggesting that's a good idea?
Well, I personally think that everybody at this point should just be hunkered down. We shouldn't be traveling from one place to another, shouldn't be going to second homes. It's shelter in place. And so I think I've encouraged additional restrictions to be put in place. I've sent a letter to the governor today expressing that, we would like to have more local authority over the restrictions of what are essential businesses. That's still a concern for me. We still have a lot of trades that are, continuing under the governor's ruling that they're essential businesses. I think we need to further refine. Our resources are restricted and limited here. I want to reassure everybody that the food supply chain is in good shape. And a lot of the initial, panic buying has subsided now. People are, being much more careful about going out, and therefore, are avoiding the grocery stores as much as possible and only going out when it's really essential. And I think that's extremely important to continue that practice. And again, all the basics, washing your hands, decontaminating and disinfecting surfaces that you have. This is going to be a while before we get through this. The governor's, I think, done a tremendous job and being very aggressive in addressing this. But I think we can fine tune that out here in East Hampton. But if we get the authority to do so, currently I don't have that authority under the governor's executive order. That's pretty much limited my ability to have more restrictive orders put in place here locally.
Do you have any idea? I mean, I know you don't have a crystal ball, but do you have any idea how long this could go on for?
I don't think anybody really knows, but I do think, we're at the very beginning of this in terms of cases and the spread, and we're going to see pretty sharp uptick in cases throughout the county and probably here in East Hampton as well. The virus has been here for some time, and, partially due to the lack of testing, the inability to get tested, we haven't really been able to get a handle on just how widespread it is. Another reason why we need to just shelter in place and avoid each other as much as possible, because we don't really know how widespread. But we're seeing in the numbers, and I think there's an idea that this surge will continue over the next 21 days, and we'll peak at some point during that time. It could be in the next couple of weeks, but we're seeing a pretty sharp increase in the number of cases. As of yesterday, we had 2,260 cases in Suffolk County. That's up significantly in the last couple of days. They're countywide. They're now 17 deaths. We had 13 cases confirmed on the call last night. However, I have some anecdotal information that there are actually 15 now, and by the call with the county executive later today, I expect that number will increase.
Right.
There is now a mobile testing site in Stony Brook, and you need to call ahead if you need to get tested. They'll pre-qualify you for you to go there. All that information is on the town website. I would encourage people to, look at the town website. It's www.ehamptonny.gov. We're putting up continual updates, pertinent information here in town about what the town's doing, what services are available. I want to say that one of the really encouraging things about living in a small town is just how everybody comes together to help each other out when times get tough. And it's really no different now. That is our greatest resource. I mentioned that before when we were on together. We have food pantries that are meeting people's needs at this time when they're out of work. Those numbers have increased. Obviously, the number of clients they're all seeing has grown exponentially, and it's important to support them. And people can do that monetarily. Again, visit the website. We have links to each one of the local food pantries. The Justice Department has been doing God's work, really. We have a number of senior clients and those with particular special needs that we've been providing meals for. We've been doing critical shopping in some cases for shut-ins if they need prescriptions picked up or need some groceries picked up. We're also dropping off frozen meals. We're working with Meals on Wheels to provide food as well. You can call the Human Services department for more information at 631-329-6939. That's 329-6939, and they can help you out. If you know people in the community who are shut-ins, we're also doing a call list. All the clients on that list are getting called at least every couple of days just to check in, make sure they're okay. And we have a number of people who've called us to volunteer to help out in various ways. And so we're putting together a master list of those who have resources or have time.
That's fantastic.
So
that was my next question, is what people can do to help. Because you said the other day, and I thought this was great, the best way to help is to keep yourself healthy and keep home.
Yeah.
And I thought that was very,
Yeah.
a very, very good sage advice, considering that if I go out and I break my leg, I am going to, cause the system to overload just from right there. So I thought that was really great. And I know that people are dying to figure out how to help, and they want to. And this community is really working very hard to do that, I think.
Right. Well, as I said earlier, that is the easiest way to really help to reduce any potential additional stress on the system. But again, if are able to volunteer or have resources that you'd like to provide, you can call us at Town Hall, and we're putting together sort of a master list of folks and organizations who are standing by to help and to be able to plug in these resources. The town board is also looking at putting together some resources to deal with what will inevitably come in terms of business assistance and business recovery planning. Many of our businesses are seasonal. We don't know what kind of season we're going to have this year, if we're even going to have a season.
Right.
That remains to be seen. Hopefully we will. But there's also additional resources that are being brought to bear from the county, state, and federal levels as well. I was pleased to see that, a recovery bill was passed by the Senate unanimously. It's nice to see that when things really get bad, that we can still come together as one nation, one people living together for the benefit of all. So hopefully that dynamic will continue. We'll be able to get more things done. Locally, we've been extremely busy. As I said, just connecting with our hospital, being in touch with them about any needs they have and what their plans are, getting updates from them. We have our Human Services Department going full blast. We also have daycare that's for the children of essential workers, in particular healthcare professionals and emergency responders. And this includes school-age children as well, and that's being offered at Eleanor Whitmore Early Childhood Development Center. And you can contact them. Their email is ewecc.org. And again, if you need any of this information, you weren't able to jot it down in time, go to the town website, and there are links to all these various organizations. As you probably know,
at the end too of this.
Yeah.
One. I think you guys are having the town board is having a meeting tomorrow that will be on LTV Live. That will be just you. And can people call in? Is that what's happening?
We're not having
call
a
in.
call
Okay.
in. They can send emails. We thought best at this point not to take a direct public comments over the phone. People could and have been sending their comments pretty regularly, questions and advice to myself and to other town board members, as one would expect. And we've been handling those many requests and inquiries pretty efficiently, I would say, for the most part. Again, we're going to tomorrow focus on some of the steps the town has taken to date and what services are available, what issues and concerns that we need to be talking about moving forward. And then we also have just some essential business, which we'll conduct in exec session regarding litigation and contracts and personnel issues. So mostly tomorrow it's an update. We'll have discussion about, what emergency preparedness in conjunction with my office and the chief of police have been up to, and just pretty much bring everybody up to date.
Okay,
Gives the
fantastic.
town board an opportunity to meet together and discuss in one place, because open meetings law would require that we do that in a public forum. Again, we'll have a televised meeting on LTV, and we appreciate all your help in helping us effectuate that.
Very welcome.
Members will be dialing in remotely like we're doing right here now.
Yeah,
And
it's pretty much
then we'll go.
this format that you'll have, but with 6, I think, boxes.
Right,
instead.
six spaces.
Well, Peter, thank you so much. Is there anything else? Any final words?
So I would just like to say and reassure people that we're going to get through this. It's going to be okay. It's going to take us a while, and it's going to require some patience and some self-sacrifice. And, I think somebody had said the other day, and I thought it was pretty apropos of the situation, that, citizens in the past have been called to serve their country and to protect their country. And many of them have, sacrificed their lives to protect us. And really all we're asking you to do to sacrifice is just to stay indoors and sit on your couch or whatever for a while. Let's just chill this out, make this virus slow down so we're not overloading our health system. And, we're going to pull together. We can bring resources to bear for those in needs, to serve those. And again, I just wish everybody to stay safe and healthy and stay calm. We're going to get through this. I want to thank LTV. You've been updating the crawler with the messages that we've been putting out, and that's really helpful at this time. So
Well, you're
thanks,
very
everyone.
welcome, Peter. Thank you.
I want to start off by saying that our entire community has been so generous in stepping forward to support vulnerable families of all different backgrounds.
Quiero decir empezar diciendo que nuestra comunidad completa se ha portado tan maravillosamente y tan generosamente apoyando a miembros de la comunidad de diferentes lugares.
Right now, OLA is focusing very much on crisis needs around food.
En este momento, OLA se está enfocando principalmente en las necesidades críticas alrededor de alimentación.
Very important for everyone to know, whether you need help or whether you want to offer help, that you can definitely go to OLA's Facebook page.
Es importante para que ustedes sepan que sin importar si son ustedes los que necesitan ayuda o si quieren ser voluntarios y proveer ayuda, que vayan a la página de website de OLA.
And the Facebook page for OLA.
Y la página de Facebook de OLA.
Okay. Also, you can call this number, 631.
También ustedes pueden llamar a este número, 631-899.
3441.
3441.
That's 631-899-3441 for OLA. You'll leave a message with your name, your number, and what your need is if you want to volunteer or you have a need, and we will get back to you.
Ese es el número de teléfono de OLA, 631-899. 899, what's another number?
3441.
3441. Por favor, llamen por teléfono y déjenos un mensaje para comunicarnos sus necesidades o su voluntariedad para apoyo.
So right now, we're working with more than 30 families.
En este momento estamos trabajando con más de 34 familias
that are in very, very great need with only 1 to 2 days worth of food.
que tienen una gran necesidad con alimentación solo para 1 o 2 días.
Volunteers are being connected to each family to stay with them and help them to source food on a weekly basis.
Estamos conectando a voluntarios con cada familia para poder determinarles y estarles llevándoles comida de forma semanal.
Some of these volunteers are coming from the church. They are Latino, they are non-Latino, they are just community members that want to help.
Algunos de esos voluntarios vienen de la iglesia, ellos son latinos o no latinos, son miembros de la comunidad que quieren ayudar.
There's a temple in Sag Harbor that has a group together that's helping a couple of families.
Hay un templo en Sag Harbor que tiene un grupo, ha unido un grupo que le está ayudando a varias familias.
And while OLA is primarily focused on the east end of Long Island, we are receiving phone calls from Wyandanch and Lindenhurst and Bayshore.
Y a pesar de que Hola se enfoca principalmente en el East End de Long Island, estamos recibiendo llamadas de Wyandanch, de Bayshore.
What's very important to me right now, seeing the trends that we're seeing, is that in the event this is something that continues more than a couple of weeks, OLA is right now trying to work with Suffolk County to learn what the next steps might be in terms of connecting food to people that might be homebound in their homes.
Lo que es bien importante para nosotros en este momento es que OLA pueda comunicarse con el condado de Suffolk para determinar si esto va a durar más de 2 semanas más o más semanas, para determinar cómo podemos nosotros conectar a las necesidades, las personas con necesidades de comida con los servicios disponibles.
We are working with families that are homebound for a variety of reasons. It could be compromised health, small children that can't be in school, no transportation, and the fact that it's not safe to be out.
Estamos trabajando con familias que están encerradas en las casas por diferentes razones. Pueden ser razones de salud, razones que tengan niños pequeños que no pueden ir a trabajar y principalmente porque no es seguro para nadie el estar afuera.
So the volunteer help is needed, the support is needed, and the offer to help is there. We are working full-time with 5 people on our staff, and we still have energy to help people that need it and to connect the dots as we can.
Así que la necesidad es más grande. También tenemos los voluntarios y tenemos la disposición para ayudar y estamos trabajando con los 5 miembros de nuestro equipo para tratar de conectar eso y para llevar y ayudarle a las personas que lo necesitan.
So the food is a number one focus for us right now. We're also making sure that any families and anyone that we're working with understands the pantries in their area, understands any other type of food resource that they might have access to. But the reality is that for some families, they don't have access, and we need to make sure that they're not falling through the cracks.
La necesidad, nos estamos enfocando principalmente en la necesidad de alimentación y tenemos que también poder conectar con los diferentes despensas, las diferentes pantries que están proveyendo comida y poder mantener ese tipo de suministro apropiado.
Many members of our Latino community are also part of workforces that are deemed essential, which means that many of them either have to be out working or it's if they don't, it's a difficult thing. So they are part of the workforces that are still deemed essential. So for those families, we just want to make sure that their work arrangements are as safe as they can be, that they have support in the event that they do become sick, that they're able to stay home.
Muchos de los miembros de la comunidad latina son miembros también del mercado de labores que se considera esenciales, o sea que ellos también tienen que salir a trabajar y nosotros queremos también proveerles seguridad para que estén informados de cómo mantenerse seguros en sus hogares.
Recent state laws that have come out that we will be posting on our Facebook page and website that relate to the legal requirements of any employer if someone is ill to be able to be home and to be paid for that time, I think up to 10 days, but all the details will be on our pages.
Hay nuevas leyes estatales que se están promulgando. Nosotros las vamos a poner en nuestra página de web y en la página de Facebook para que la gente esté enterada, por ejemplo, si los empleados están enfermos, qué se puede hacer. Creo que tienen derecho a 10 días, pero nosotros vamos a obtener esa información y la vamos a actualizar a medida que obtengamos eso.
OLA wants to also make the offer that to employers that might need help navigating what kind of relief that they might be getting from the state or from the federal government. Also, even with homeowners and people who are renting out their spaces, if they have questions or concerns about how they might have mortgage relief, we're also working on that side of it so that the entire East End, all pieces of the puzzle, we recognize as being necessary to support so that the entire health of the East End is considered and not just one piece of that puzzle.
Hola también quiere informar y quiere mantener a empleadores informados, aquellos que tal vez tengan pequeños negocios y que también estén tratando de averiguar cuál es la mejor forma de continuar, a dueños de hogares o a inquilinos que tengan problemas pagando o pudiendo pagar las facturas. También queremos ayudarle a todos los miembros de la comunidad en este momento que es tan difícil.
Yeah, so we do urge anyone that might need some assistance in those areas to reach out to Ola. We could try to direct you to the right offices, or we will try to do that with you on a three-way phone call if you don't speak English.
Queremos decirles que a cualquier persona que necesite ayuda en esos campos, que por favor se comuniquen con Ola y nosotros vamos a obtener la información, los números adecuados para poder ponernos en contacto con la persona necesaria.
Okay, and also Thank you. And also we'll do a three-way call if English is not your first language and it's a very tricky conversation, a little more complex. We'll try to do a three-way call with one of our staff.
También entonces vamos a hacer una llamada de 3 días. Si el inglés no es su primer idioma y es algo complicado para poder comunicarse o entender la información, vamos a conectarlos por una tercera vía con un miembro de nuestro personal.
One more thing before we end, I want to again thank our entire community for their strength, their generosity, and even those in crisis are so generous and calm. It's amazing. I want to.
Una vez más quiero agradecerle a toda nuestra comunidad su fortaleza, su generosidad, incluso en crisis siempre están mostrando lo mejor.
And I want to say that right now, Ola is also working with schools, with area districts to help buy and provide Chromebooks for those students who are going to be doing remote learning and do not have devices.
Y quiero también decir que en este momento Ola está trabajando con las escuelas y los distritos escolares para ayudar a comprar Chromebooks para poder dárselos a esos alumnos que no tienen acceso.
And those students are both Latino and non-Latino. So I want to stress the fact that Ola is here to support the entire East End, and we're happy to do it.
Y esos estudiantes son latinos y también no latinos, porque quiero decirles que Ola está aquí para ayudarle a toda la comunidad del East End.
Thank you.
Thank you.
Gracias.
We are very excited today to have somebody who we consider a good friend and neighbor, Scott Howe, the executive director of the Animal Rescue Fund of the Hamptons, which is right down the street. And, obviously this is a time I'm going to introduce you to, this is Allie. This is my teacup Yorkie, really my daughter's. And I can't imagine a time, more important time to have an animal that you can pet and love and hug. So everybody's been asking a lot of questions about their own animals and also about adopting and fostering. Tell us what's going on with ARF.
Sure. So ARF is affected like everybody. As a shelter, we are designated an essential business, but there are some restrictions to what we can do. And then ARF has its own interpretations of what's in the best interest of the animals and the staff. So with the current orders from the governor, shelters like ARF are restricted to intake only animals from New York State, which makes perfect sense under the circumstances. ARF normally brings in dogs from communities across the country and for rescue, and that needed to stop. We have, this is Abigail.
Hi, Abigail.
At the same time, Abigail has a mind of her own. I don't think she's
a cat.
She didn't sign a release for this.
Right.
But the other important part is, and I respect what the governor is trying to do, is that this is not business as usual, and we're weighing our own life-saving mission with animals with the public well-being and the health and safety of our staff. What weighs on me every day is the safety of my staff and their families, because without them, we can't care for the 90 animals that are with us here at the shelter today. So I'm still at ARF.
You are. How many staff members are at ARF now? So you said there are 90 animals there. Tell us who's working there now. How many people are there?
The animal care staff is here, and our veterinary and medical staff are here working, but they're on alternating schedules in teams so that they so that our veterinary staff doesn't overlap. We're trying to reduce the density of people in the building, and they're spread out throughout the building. They're wearing masks inside when they do tasks like prepare food for the animals, but most of their work throughout the day with the animals of walking, going into the catteries is solitary. So yeah, go ahead.
No, so ARF is essentially closed right now to the public, but are you still doing
Yes.
adoption? So it's closed. But
if we take the governor's guidelines seriously, we should be staying at home, so we stopped doing adoptions this week. We just felt also right now, it's difficult. Access to veterinary care is also limited. It's limited to emergency procedures. So, our standard recommendation to a adopter would be to go take your animal to your vet, start a relationship with your vet, go through a basic wellness exam, and any follow-up vaccinations you'll need to do with your local vet. But, that's not happening right now. We know that people are yearning for some comfort. They want to, they'd love to have an animal. Maybe they've been considering it, but we honestly had to reflect and say that this isn't the right time. It's not the right time to encourage people to leave their homes and to come to ARF. And I think I have a responsibility to my staff to limit their exposure to the public as well. And we will get through this. This is temporary, but it's necessary.
What if somebody is home with a lot of time on their hands and they want to foster? You've gotten a lot of calls. I understand. I spoke with Jamie at ARF to foster.
Yeah,
is it impossible?
we have. It's the same thing. People need to stay at home right now. Fostering involves coming to the shelter. It involves coming inside the shelter. It involves interaction with staff. Going out to getting supplies for a new animal that you're fostering. It's just it may feel wrong in your heart, but it's the right thing. We just had to put a pause on all of that. And again, we feel it's in the best interest of the animals that are still here, that we keep our staff safe and healthy. There is going to be a great need on the other side of this. Don't get me wrong. We had an outpouring of support from fosters. We have a waiting list ready. The need is going to come from two places. It's either going to come from our local community or here in New York as the virus takes its toll on families and animals potentially are surrendered. And then it's also going to come from all the states where ARF normally receives rescue transports, Texas, South Carolina. Those communities are also on hold now. And we're so as soon as it's safe to do so, we have to ramp back up very, very quickly. But we also have to be prepared to help our own local community. And that so we reduced the number of animals in the building. We did great adoptions. We have animals out on foster. We have a quarantine space cleaned and ready to go. But for whatever the need is going to be, and we're anticipating, again, those two scenarios I talked about, either locally, and we hope that isn't the case, but we have to be ready. It's our responsibility. But we also need to be ready for those southern states whose shelters are just exploding right now because shelters in the Northeast can't accept their animals.
So we have so many people who love ARF, who love animals. I spoke with Morgan right before this interview, and Morgan Vaughn at LTV, and she said she has a friend who's desperate to get a dog, and so they can't call ahead right now. But there are some other shelters in Long Island that are still conducting adoptions. I understand. Is that correct? Would you advise them to go there, or is that a?
People should be staying at home. People need to stay at home. I watch the governor every day now. I think he's doing an incredible job, politics aside, and that is the one takeaway. This is not the time.
I understand. So I know what you're saying, because people are not social distancing the way we would think they are, right? In some instances, I hear about people who are congregating on the beach. What do people take their dogs, and go on the beach? And is it okay if the dogs run together and everything? And in New York here, people went and looked at the big, emergency ship that came in, and all way too close for my liking. It's hard. It's a hard thing. But what do people who are frustrated with animals do? For the animals, or rescue cats, or they can't do anything right now, I guess.
They need to take care of themselves and stay healthy to be there ready for us on the other side. And ARF, like any nonprofit, right now, what we need is financial support. And it's a hard message. It's a hard ask to make right now when so many people are struggling and hundreds of thousands are losing their jobs weekly. But that's going to be the story of any rescue or shelter right now. And that is the need.
Yeah. I mean, you stroll to the beach and the Bow Wow. I covered for LTV those events this summer, and the thrift shop.
We can't plan for that. Yeah,
we don't know how that's
closed. Yeah, the thrift shop's been closed since the middle of March.
But let me ask you something. So, I mean, if somebody had, you say the financial need. So, for the average person who maybe even has lost their job but wants to do something for ARF right now, what can they do? Can they donate towels or toys, or can we drop them off?
Again, people should stay at home. Stay at home. And if you check on other shelters, people may be sending out the different message. Ultimately, I have to make that decision for our community, and I take it very, very seriously. I've got to protect our animals, and I have a responsibility as an organization, as a business, not to put people at risk and not to put my employees at risk, because I can't do my mission without my staff. And they're uncomfortable taking donations right now of towels and items. Everyone's just nervous. And so I want to reduce that anxiety and that stress for them, because they do have to come to work. And I know that they have families at home. And so, it would be easier if I had the type of business where I could say, all right, we're all working from home, but that's not the case. And so there's a added layer of responsibility on me. So as hard as it is for me to say no, I have to. And I have to be prepared for people to tell me I'm wrong, but I have to take this seriously, and people should know that we're going to get to the other side of this. ARF has been here for almost 50 years, and our community and our country is going to need ARF in ways like we've never imagined before on the other side.
So for somebody who wants to do something, it's basically the best thing they could do right now is to stay home, right? Is that what you're saying? And then to stay healthy, and if they can, obviously, if they can support you financially, and if you've got people who have lots of money, which I know there are some heavy hitters in all organizations on the East End, big and small.
Everybody needs help right now, and it's just I don't deny it. Our FIS, but the other thing we can do is just our own social responsibility of staying home. Staying healthy. That's the way you can help us all. And we'll be on the other side of this. And there will be animals that are going to need you. I look forward to when we can start sending animals out on foster, and we can start helping other shelters that are going to be hard hit by this down the line.
I appreciate you being here with us at LTV. We support everything that you guys are doing, and we can't wait till the day when we can come back and say that ARF is open. Is there anything else you want to say to the community out there who love animals and who are supportive of what you guys do?
Just stay with us. We're trying to put out good stories on social media to let you know how we're taking care of our orphans. And we'll keep you posted as opportunities for fosters and adoptions take place. We're still accepting applications online for adoptions, that we're not going through with them right now. So all of that's still up on our website, rhamptons.org. And just know that as soon as possible, we're going to be back up and running, and there are going to be thousands of animals who are going to need us in the future. So stay with us.